On the day of surgery, you will not have had anything to eat or drink after midnight, the midnight before the morning of surgery. We'll come say hello, we'll cross all the T's, dot all the I's on all the forms that we have to fill out. The surgery will be between 1 and 3 hours. Of course, that can be quite variable depending on what surgery you're having, whether you're having a gallbladder too, etc. You can expect, though, that your family members or friends who might be with you may not see you for several hours, so 4 to 6 hours or so, because it takes time to get the patient to sleep on the operating room table, time to wake up, time to get out of the recovery area, time to get up to the nursing floor. We're going to get you out of bed right away. We're really harping on these blood clots, okay? We hate blood clots. This is one of the most preventable things we can try to take care of, is preventing blood clots. And so if we get you out of bed walking, it's not because we're trying to punish you, it's because we want you to not get blood clots. And so that will happen the day of surgery. After surgery, you're going to start drinking water right away. You can start as soon as you're awake enough to swallow and not choke. Several hours after surgery, you can start drinking water. And then once you've had enough water to drink, once you've demonstrated that water is going through well and it's not coming back up, the swelling is not too bad, then you can start on some protein shakes. And these are the protein shakes that you're going to be taking at home after surgery too. And we'll start them here in the hospital. In the meantime, you're getting out of bed and walking. We'll give you a little device to help you measure how well you're breathing. It's called an incentive spirometer. And then once you've established that you can drink a fair amount and we're confident that you're not going to become dehydrated once you get home, then you can go home. So that might be on day 1 after surgery, it might be on day 3 after surgery, as soon as it's safe. At home, so you're going to be walking, of course. That's the best exercise for starters. Don't try to push it too quickly and go to the gym, although if you're feeling great, okay. But your source of protein in this period is going to be these protein shakes. And so 45 to 60 grams of protein a day, that's low for the average daily needs that a person has in general, but it's enough to keep you going during this phase of your recovery. It's enough to keep all the bodily functions working while you're recovering from surgery. So you'll be working on that. And most importantly, you'll be working on taking enough water. So 50 to 60 ounces, 64 ounces is a half gallon, right? So you're going to be drinking about 2 quarts or a half gallon of water a day. And again, you're going to be doing it with small, tiny sips. So you're going to be drinking constantly. There is some post-op nausea occasionally. Usually that's gone within the first 24 hours after surgery. In other words, usually that goes away before you even go home. Rarely a patient might be nauseated persistently, so if that happens, call us. In fact, call us for lots of different reasons. We'll talk about that in just a moment. You may have a lot of energy after surgery. Some people bounce back really great. Their blood sugars are already normal. They feel fantastic. But some patients, and it's impossible to predict whether it's going to be a patient who was energetic before surgery or not, might be fatigued, and that fatigue might last for a month or 2. It does get better, it does go away. You will start to feel the benefits.
So with all this, once you've had the surgery, most people stay in a hospital 1 day, sometimes 2 days. And then when you go home, you can walk around, you can drive a car in a few days. In terms of going back to normal activity, that depends a little bit on what your normal activity is. Really heavy lifting should not be done for 4 weeks, but lighter activities people can do as they please. Some people have a lot of fatigue. Some people are really active. Everybody's a little different how they feel, so we can't really tell you one way or the other. I always recommend take 4 weeks out of work or plan not doing anything important for 4 weeks. You might need that time. If you need longer, we give you longer. If you're going to want to go back in a few days, that's fine. I've had people who went back to work after a week for desk job, or even brought their computer to the hospital, did work from the bed. Anything is possible. And then weight loss. It usually stops for some people after 3 months already, for the majority after 12 months. In the SADI, it can go on for 1 or 2 years. Important for a person to know is that we can almost predict how successful you will be almost already in 3 months. There have been studies that show that if a person really knows how to change their behavior from the beginning and can lose weight well, then they will do well in the long term. So if a person does not achieve 50% of the weight loss that we expect in 3 months, they'll probably not do as well in the future. So why I'm telling you this is that if you have the surgery will do the trick for you. It'll make you not eat. It'll make you eat small portions. But it usually does not make you change what you eat. Sometimes it does, but not always. So just because you're eating a little bit doesn't mean you should eat a little bit of pizza and a little bit of French fries and a little bit of whatever awful drinks. Because if you eat those little things, they still have a lot of calories. And then in the future, they will become a little bit more. So that one slice of pizza or that bite of pizza will turn into one slice, into 2 slices, even with those surgeries. So the whole idea is that you eat less, but you also change. So instead of eating the food that has a lot of calories, you switch over to healthy foods right away. And then a person will be able to get to that weight loss. After 3 months, they will have lost already half of what they will lose altogether. That's how fast that goes. But you're going to have to change. The whole idea of surgery is to help you lose the weight, make you not be hungry, but also hopefully entice you to lose and to change your habits. It's because even the portions are small, so you can eat, if you eat a handful of food a year or 2 after surgery, if that handful of food is a muffin from Dunkin' Donuts, that's 600 calories. That's just a handful of food. But the other, if you eat a handful of vegetables and a little bit of chicken, that's 100 calories. So you pick, you eat the 600 calorie donuts or the 600 calorie muffin, or do you eat the 100 calorie healthy foods? That's where you come in as a patient. And coming back to the question, how do people gain weight back? This is how people gain weight back in the future. Because they make poor choices. They will eat the muffin, the French fries. They will drink cream. They will put butter on everything. These are things that will go down. And that's how people gain weight back. It's not because they eat too much broccoli or even regular, I mean even steak or meats or potatoes or rice. I mean, if that's all doable. If the portion's like this is all doable. It's all the other things. Or if you snack a piece of M&Ms all day long, there's no surgery that can help you with a person like that. So, but that's also why we appeal and say, come back to us, see our dietitians, go to support groups, maybe even go to our counselors, go to Weight Watchers, go to Overeat Anonymous, whatever works for a person. It's the whole thing. It's a village. It takes a village that makes that work. Because having obesity is such a complex and difficult problem in our society. We want to get you on the right path. We want to be there for you. We want to guide you along, but we can't do it without you. So that's our appeal that we always have.